So please start your session.
Okay, thank you. So today evening, decoding the human walk basics of gait analysis. Why this gait analysis is important? Because the moment patient enters in your OPD chamber, you must know how the patient is walking. Is there any deformity or something that differs from the normal gait? Then you will be able to start doing your differential diagnosis from that point of view. So today I am going to only discuss about the normal gait analysis. What are the things that is important and the basics things, so that once you know the normal part of the gait, you will be definitely find it easier to sort out the abnormal thing or something which is different. So the more you do the basically the gait analysis is evolving day by day, and it has got a lot of role in people with stroke, cerebral palsy, sports injury. Why sports injury is important? Because see, especially if someone is a football player, or you have to decide whether he or she is fit to be part of the football team. What are the muscles you have to work on? Which, if he has to work as a goalkeeper, or he has to go for and do a forward and play in the middle, so there will be different energy consumption, different group of muscles that needs to be worked on. So accordingly, same thing applies in the cricket also, and every sports has its own role, especially in which running is needed. For example, if someone is a fast bowler, you need to work on different group of muscles, and if someone is a spinner, that needs a different analysis. Mostly we think and mostly we discuss that gait analysis about the leg movement. Must always remember one thing, that gait analysis is not only the lower limb movement, it also involves the, or it is affected by the gait, or um, the hip, the shoulder, then the upper limb also. The movement of the upper limb and the shoulder, everything will contribute in the gait of a person. So what are the step and the stride? It is always a confusing terminology that is asked. So best way to remember whether it is a step or a stride is, a step is a step mother or a step dad or a step mom. So it is the some other dad, some other mom. So step is the distance covered by the heel of one side and the other side. That is the distance covered. So that is called the step. This much. This is the left heel, and this is the right. Stride is the same side. Difference distance between the two heel contacts. That is called the stride. So always remember, these are the confusing terms, especially in the examination. What is a step? What is a stride? So you must know this. Step is a step. This is how I remember the step dad, a step mom. Okay, other side. So this is the best way. So there are things which you must know how to do it. Support, there are different types of support: cadence, center of gravity, base of support. These are the things that contribute and determines the normal gait. What is the double limb support? Double limb support is that part when the both lower limb is in contact with the ground during any gait cycle. So it is around 20%. Single limb support is that one limb is in air or is in the swing and other limb is in touch with the ground. That is about the 80%. Cadence, it is the total number of steps taken per minute. And the center of gravity is very, very, very important. Why center of gravity is important? Your first center of gravity is 5 centimeter in front of the S2, and the movement is 5 centimeter vertical and the anterior. Now, why the center of gravity? What it helps or helps us determine is the any prosthesis, any orthosis, or even in the diagnosis, if center of gravity is changed, then you will find that there is some issues. For example, take for example change of center of gravity of a obese, morbidly obese person. You will find that there is a tummy and there is shift in the center of gravity, or even in a pregnant woman, you will find that change in shift, and they will put their stride will come down, their step will come down, their speed will come down. So that is the importance of center of gravity. Everything, diagnosis or treatment, it revolves in the gait around the center of gravity. So if you are giving any prosthesis or any orthosis, you have to make sure that center of gravity does not change much. The moment center of gravity changes, there will be patient may fall down, fall back, everything, anything can happen. So base of support is the distance between the two heel, and that is another important thing. Whenever both heel are in touch with the ground, at that point of time you look at the base of the support. So the normal base of support is around 10 centimeter, 6 to 10 centimeter. It depends again on the physique, how to put this and keep the center of gravity at that point of time at the base. So I like my tea pre-sweetened. You all must remember these two things. I like my tea pre-sweetened. Always remember, I like my tea pre-sweetened. I, initial contact, like, loading response, my, mid stance, T, terminal stance, pre-sweetened up to this pre-swing, pre-sweetened part is there. It is a part of the stance phase. And what about the swing phase? In my teapot, in my I for initial swing, my mid swing, teapot, terminal swing is the teapot. So I like my tea pre-sweetened in my teapot is all the gait cycle or gait analysis or gait cycle is an important. Now we'll come to the initial contact. What is happening in the initial contact is that heel is coming in contact with the ground. That is the most important point. Now when the heel is coming in contact, then this will be followed by this sole will come in touch with the ground, sole will slap down, that is called the loading response. Okay, and then comes the mid stance when the ankle are in touch or in collaboration or tibia crosses over, and then comes the terminal stand when heel start rising and the other side of the heel touches the ground, that is the terminal stance. And comes the pre-swing when the other side or contralateral side comes into of the sole comes in touch with the ground and the other side heel starts going up. Now what are the important things in this initial contact? Initial contact, what is the condition of the hip? I'm talking about the same side. Hip is in a bit of flexion. What is happening to the knee? The knee is in neutral. I don't want to go into basic 0 degree, 5 degree, because remembering this 0 degree, 5 degree, it is better to go for a proper gait analysis. But from clinical point of view or whatever you are doing in the OPD, it is neutral. It, 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 it is neutral. And what about the heel, dorsiflexion, plantar flexion? So we will call it a neutral. Okay, this is tibia is forming almost 90 degree with the lateral side of the sole of the foot. It is neutral, or it is little bit of dorsiflexion. So how to decide whether the leg is in dorsiflexion or plantar flexion? It all depends on the position of the tibia. Whether tibia is moving forward or backward, it will depend. If the angle is less than 90 degree, it is dorsiflexion. If more than 90 degree, plantar flexion. So remember this. Now the moment this limb goes into the loading response, what is happening to the hip? It is little bit coming from the flexion to little bit extension. Although it is still in flexion, what is happening to the knee? Knee which was neutral or straight, now it has done little bit of flexion. Now what is happening to the ankle? If you look into this ankle, the tibia is still backward. So if you look into it, it is little bit of plantar flexion. Then comes the mid stance. Everything is a straightforward, single leg stance. Other leg is in the air. Till loading is response, other leg, if you look at the contralateral leg, it is in touch with the ground. Now the other leg is in air, and this limb is straight, almost straight. Now what is the position of the hip? Hip is in neutral, knee again neutral, which was little bit of flexion. And now the ankle, if you look now, this tibia is moving forward, so this is now again going into neutral. So one important thing difference between loading response and the mid stance is this loading response center of gravity is the lowest. L for loading, L for lowest, center of gravity is the lowest, and in mid stance it is the highest. Okay. Now come to the terminal stance. In the terminal stance, what is happening? Now this heel will start rising, the contralateral leg will come forward, and the heel of the contralateral will touch, and the heel of the same leg will start rising up, although it will be in touch with the ground. So that is called the terminal stance. Now coming to the, now in the terminal stance, again, what is happening to the hip? It is neutral or going little bit of extension, not much. What is happening to the knee? Knee is again started going into the flexion. What is happening to the ankle? Ankle, if you see, the angle is increased, so it is bit of plantar flexion. So for plantar flexion. Now come to the pre-swing. In the pre-swing, what is happening to the contralateral leg? If you look at the contralateral leg, it is in touch with the ground. Now what is happening to the same side of the leg? Heel has completely raised, only toe is touching. That is the pre-swing. Till that point is the pre-swing. So I like my tea pre-sweetened. Okay, it is a common tea that is served. No one is going to ask you how many spoons of tea, spoons of sugar now you need. Although until unless the shopkeeper is quite obvious and he is himself diabetic, he will come and ask you whether you need a tea or we need a sugar or not. Now it should be in my teapot. So in your teapot, what is happening? I for initial swing, M for mid swing, T for terminal swing. Now in initial swing, what is happening? It is acceleration. Acceleration means your toe is about to rise. Now what is happening to in the mid swing? This toe is almost in the air. Now the ankle is about to cross over the contralateral side. Now the moment it starts, it is called the mid swing. All throughout, when the mid swing, our heel is in air. That's it. It is swinging. That is called the mid swing, and this is followed by the moment it starts or it starts reaching towards the ground, heel is about to touch. It is called the terminal swing. If you look at it carefully, this terminal swing photograph and this initial contact, it is more or less same, only the legs have changed. Okay, that's it. Terminal swing, the acceleration, it is more or less same. The features are same. Now, in the initial swing, what is the condition of the hip? Hip is going little bit extension. What is happening to the knee? Flexion. What is happening to the ankle? Again, it is in plantar flexion. And this is the stage where there will be maximum plantar flexion or called the initial swing. And also the knee will be in maximum flexion so that it can generate the maximum energy. Then this is followed by, now what is happening to the hip? Hip is gradually moving forward. So it is from extension, it is now moving towards the flexion or neutral followed by flexion. Knees again in flexion, and ankle is almost now it is still in the plantar flexion, but this plantar flexion angle will increase. Now what is happening in the terminal swing? Now in the terminal swing, if you look, hip is in extension, knee is almost neutral. From flexion, it is changing into neutral, or you can call it extension also. It is from flexion towards the extension, and the angle, this is plantar flexion. Little bit of plantar flexion is there, or it is neutral. So this is all in my teapot. So this is the thing that you must remember: what percentage of our gait is in swing phase and what percentage is in the stance phase. 80-20, 60-20. These are the terminologies which is always confusing. So best way to remember is the 60 and 40. Okay, so first angle will be around 0 degree or something, 0 to 2 degrees. That is the initial contact, is that it is the time that it takes. And then loading response to terminal stance, it is all 20-20-20% of the time. So it will be something around loading stance is 0 to 10, 10 to 20, and you can keep calculating. And the last swing phase, it is about on an average 15%. On an average, I'm not saying exact number. So pre-swing to initial swing, it is around 15%, 10 to 15%. That is what you have to remember. An important question that is always asked in the examination, and you must know about this eccentric contraction and the concentric contraction. E for elongation, E for elongation, C for contraction. Remember it. Always remember E for elongation of the same group of muscle to manage the load. Now, concentric action happening. This concentric action is happening. For example, in iliopsoas, concentric, it has to contract. Concentric iliopsoas is the muscle which always contracts. So contraction part of the iliopsoas will be from the terminal stance to the mid swing. That's it. Okay. Gluteus maximus, it is mainly in the initial contact. It is eccentric. Most of the contractions are eccentric. Concentric is mainly in the calf muscle and the pre-tibial muscles during the terminal stance to the terminal swing. Terminal stance to terminal swing. So this pre-tibial concentric will be from the initial swing till the terminal swing. This is the pre-tibial muscles are very active. If otherwise, it is mostly inactive. Calf muscles are mainly active in the terminal and the pre-swing. Why? Because we need maximum plantar flexions at that point of time. Quadriceps, when it is strengthening or lengthening, it is quadriceps are always asked. This is a common question. Initial contact and loading response, and the at the start of any um, phase, that is a start of the stance phase and the start of the swing phase, quadriceps is eccentric. So initial contact and loading response, quadriceps will be eccentric, and pre-swing to initial swing, quadriceps will be eccentric. Now hamstring is eccentric from here, initial swing, mid swing, terminal swing to these two, initial contact to loading response. That's it about the hamstring. These two it is left. So remember last 4 and 2, initial again 6. It's because it is a cycle. That's why I told you how it all works. So this is all you should know. Now there are two terminologies. Old terminology is almost not used, but some point of time you must know. And what I feel is this old terminology is always easy to remember compared to the new gate terms. But whatever is acceptable to the world, we have to accept it. Old terminology, it was called heel strike, foot flat, mid stance, heel off, toe off, mid swing, heel strike, and everything is very, very, very important for any one of us to understand. So this is all you must know. Keep watching, keep reading, and keep understanding where is the heel or what is the problem that is happening. So that's all from the slide part. Now coming back to the, if there is any question anyone can ask. And now I will show that there are few things that is important is the determinant of gait. Gait determinants are 6, 3, 3 in the pelvis, 3, 2, 1. So if you all can see, it is 3 to 1. 3 in the hip, 2 in the knee, and 1 in the foot. So 3 is for a body to move forward. It is the pelvic rotation. Pelvis has to rotate forward. Then only it will come forward. Then pelvis has to tilt. Pelvis has to tilt down. Then it will go, and there has to be lateral displacement. Why lateral displacement is important? Just it is mainly for the stance phase. Gluteus is working there, active there. So Okay, skeletal is not visible. Is it visible now? Okay, wait. So is it visible now? Okay, I hope it is visible now. I've removed the background. So important part is I was talking about the determinants of gait. There are determinants are six, three here, two here, one here. Three is for someone to move forward. This pelvis has to rotate little bit. Then if someone has to move forward, it has to tilt also, and then there is a lateral displacement of the hip also for it to move forward. Okay, only thing is the to compare the lateral displacement is to maintain the center of gravity at the base of support. Okay, now two in the knee flexion and the knee mechanism, that we have to read and understand, and the foot mechanism. So this is where I will conclude regarding the details of the determinants of gait. We can discuss in the next class. Okay, if there is any question, any point of, you can ask, because gait is a very long topic to discuss and finish with a cup of tea. And that's why we will do this determinants of gait class in full detail in the next session, next Friday. After that, we will try to understand the pathology, and I will be sharing one article about the CP gait or hemiplegic gait, which you all just read it so that I can discuss it after the next class. Okay, if there is anything to ask, please feel free from the basics. Sure, I will add the clinical discussion because this is the basics. Clinical discussion part will be always there in the determinants of the gait. Yes, definitely it will be there, and also in the pathology, because it will take almost an hour to if I start adding it. So whatever muscles I have discussed in this class, just think where it is paralyzed because of one reason and which area will be affected, and that will determine the gait or different types of gait. Definitely, I will take care of it. Thank you. If you all are on Rehab Adda, keep posting your thought if there is anything or any topic to be added. Okay, thank you. Hope you had a good tea by now. Okay, just remember important thing. Okay, I like my tea pre-sweetened in my teapot. Okay, enjoy your tea in your teapot. Okay, bye bye. Thank you. Always remember everything about the gate 60/20. Keep reading, then only you will come to know about it. Okay, thank you.